Okay, guys. Now we will discuss question number 57, which will be the masticatory muscles. Uh, and if you guys would turn to page 54 in the Netter's Atlas, we will begin discussing. First, we'll begin with the largest elevator of the mandible, which will be the temporalis muscle. Therefore, the most important muscle for chewing or mastication. Now, let's take a closer look at the temporalis muscle. We have the temporalis muscle, this big muscle right here. Okay. Now, as you see, there's a whitish covering on top, and that is going to be known as the temporalis fascia. The temporalis fascia is going to have a high attachment and a low attachment. The high attachment will be the temporal lines of the parietal bone, and the low attachment will be the zygomatic arch. Now, if you see, the temporalis fascia has a superficial and a deep part, and in between there's going to be loose fatty tissue. Okay. Now, the job of the temporal fascia is to enclose the temporalis muscle. Okay. Now, the temporalis muscle is going to originate at the superior temporal line of the parietal bone and will insert onto the coronoid process of the mandible. Okay. And this temporalis muscle will be innervated by the deep temporal nerves of the motor masticatory branch of the mandibular nerve of the trigeminal. Okay. Now, the second muscle you see is this muscle right here. This will be the masseter. The masseter will originate from the zygomatic arch and the maxilla, and is going to insert onto the angle of the mandible on its outer aspect, and this area specifically will be known as the masseteric tuberosity. Okay. Now we move to its fascia. Now, encompassing the masseteric muscle is going to be the masseteric fascia. Superiorly, the masseteric fascia will run into the zygomatic arch, and inferiorly, it will continue down onto the cervical region as a superior cervical fascia. Frontally, it's going to continue onto the buccopharyngeal fascia, which encompasses the buccinator. And when the masseteric fascia transitions onto the parotid gland, okay, which will lie on top of the masseter muscle a little bit posteriorly, it will transition as the parotidomasseteric fascia. Okay. Now, those are the first two muscles of the mastication muscles. Now, in total, there are 4 mastication muscles. So now we will talk about the other 2 muscles. Now we will talk about the medial pterygoid muscle and the lateral pterygoid muscles. Okay. Now, the medial pterygoid muscle, let's take another look. If you go to page 55 at the bottom of the page, you can look and visualize the medial pterygoid muscle. And the medial pterygoid muscle will have 2 origins. It will have the pterygoid fossa, which is between the medial and lateral plates of the pterygoid process of the sphenoid bone. And you're going to have the maxillary tuberosity, and from there, the medial pterygoid muscle will insert onto the inner aspect of the angle of the mandible, which will be known as the pterygoid tuberosity. And then we will continue upwards, and we will visualize the lateral pterygoid. As you can see, the lateral pterygoid runs as a right angle to the medial pterygoid, and the lateral pterygoid has 2 heads, a superior head and an inferior head. The superior head will originate from the infratemporal crest of the sphenoid bone, specifically the infratemporal crest of the greater wings of the sphenoid, and the inferior head will originate from the lateral part of the lateral plate of the pterygoid process of the sphenoid bone. And then the insertions are a bit tricky as well. The inferior head will insert onto the anteromedial part of the neck of the mandible, which will be known as the pterygoid fovea. And the superior head will originate into the articular disc, which is right here, and the fibrous capsule surrounding the articular surface. Okay, and those are your mastication muscles and their corresponding sheaths. Now, real quick, I have to mention the fact of their innervation. I didn't talk about it too properly. Each of these muscles are going to be innervated by their corresponding branches from the motor masticatory branch of the mandibular nerve. So the temporalis muscle will be innervated by the deep temporal nerves of the motor masticatory branch. The masseter will be innervated by the masseteric nerve from the motor masticatory branch of the mandibular. And your medial and lateral pterygoid will be also innervated by the corresponding branches of the motor masticatory branch of the mandibular nerve of the trigeminal. Okay? And that should sum up the question pretty well.